Hello there! Today we're going to talk about nursing. Nursing's fun, nursing's exciting. Nursing is a great profession. But what makes a nurse? Why does a nurse choose to be a nurse? What are some of the experiences a nurse goes through? That is what this video will cover in my aesthetic project. Welcome to the Zachariah Show, where we uncover in this episode what nurses do and why they are so valuable to our society and what we can learn from it as we progress as human beings. So when creating these interview questions, I'm going to be looking at 4 specific topics. The transition shock from, nursing school to an actual career for the rest of your life, and how it is going to be different, and how fast does reality hit the fact that every decision you make is going to impact a life. Even though you have that experience to a certain extent with clinicals in nursing school, I feel like the pressure is more higher. And that comes from my own self-evaluation or self-assumption of what a nurse goes through as they start their career. So that transition shock is the number one thing. And I want to see how my interviewee responds towards my question related with that. And we're going to connect it with Dr. Judy Dunser's theory of transition shock and see how that correlates with my interviewee's response. The second part of this will be talking on the art of nursing, basically the emotional and mental aspect of the patient and how the nurse reacts with that. So when I ask a question more or less over clinical skills, your idea of being able to handle different things and to treat the patient as a whole. And we're going to relate that with Ping Zhu's argument that nursing is not just tasks, it's the understanding the context of the patient's life, which has been emphasized throughout nursing school. I want to see how the nurse explains this to me. So that is where I'm going with my second topic. My third topic will be critical and linear thinking. So I would like the interviewee to sort of connect the dots on how critical thinking is extremely important in the healthcare environment, and linear thinking on different areas, such as being able to handle ADPI that I was taught in school, and many other concepts that I want to see how this nurse might respond to. So obviously I've been taught all of these concepts, and I really want to discover how much of them is actually influencing the final arc of being a nurse. So that is where my third area is going. It's the critical and linear thinking, and I'm going to connect it with the textbook we have been using in my school, which is the Potter Perry's Canadian Fundamentals of Nursing. And I'm going to see how that connects with this. The last bit will be the patient autonomy and advocacy. When I mean last bit, I'm not going chronologically the way I've ordered these topics. It's more or less the topics themselves that will be addressed in the interview questions, more or less trying to grab what the interviewee has to say and what I can attain from what they're saying. Because the end result is, this project is not just for now, it's for me to advance
the interview
in my healthcare development. So when I end up going into the medical field, I know how to act and I know how to go about my things so that I can be a better person, better nurse, better healthcare provider towards my patient, which is the end goal. So the last bit is the patient autonomy and advocacy. We have a professional obligation. Well, not me, not yet, but soon I will have a professional obligation to take care of to take care of a patient. So in those areas, how am I going to be able to oblige and be compatible with a patient's autonomy when it might go against all the values I stand for. And I sort of want to see what my interviewee has to say about this and how strongly they might agree with the patient's autonomy compared to the professional obligation. To this, we're going to connect back to the CNO's code of conduct, which is supposed to state that the clients have the right to make the decisions about their own care, even if the nurse disagrees. However, the advocacy part is that the nurse must ensure the client understands the risks. So, what can we do about it? How can we make sure that they understand those concepts? And those are my 4 different topics that I'm going to be covering with the sources I've stated. The importance of this entire project is for me to grow and be a better nurse and be a better healthcare provider as my 4 years passes by and I go into my career, and from there, wherever healthcare takes me, so that I can be able to effectively take care of my patients. I go to Nipissing University and I take the program nursing, which helps us with building the idea, because now I'm giving my fresh perspective of just getting into nursing school and learning how everything works together. What is beneficial to this video is that we got one of our professors who is a registered nurse at the North Bay Hospital near Nipissing University, who teaches me health assessment. Let's see what she has to say about the scope of nursing for us to view the entire picture as a whole and learn a new perspective so we can build our idea of what nursing is.
Not right now. I'm really busy right now.
Oh, okay. All right, since that didn't pan out as expected, I don't know what to do now. This project is not going as I expected. The professor was not able to interview with me because she's busy with other stuff. You know what? Maybe at this point in the video, I'll just go to where my family is. Go to the zoo. Spend time with them. Because I don't know where to take this project anymore. Wait a minute. My mom works at the hospital in the zoo. She's got to have a couple people who can help me out, right? Maybe one of them will. Well, if I'm going to go to the Sioux Area Hospital, I'm going to have to dress appropriately. And as a nursing student, there's only one way to do that. Oh, man. Scrubs. Just got my new scrubs today. So, pretty excited to wear those. Definitely going to be wearing that during the interview. Especially in the hospital setting. Because, face it or not, this is going to be what I'm going to... Face it or not, this is what I'm going to be wearing for the rest of my career. For the rest of my life. So I should enjoy it. This beautiful piece of clothing. Alright, we're at my parents' house. My scrubs! Don't mind the mess. Anyways, we're going to be interviewing a lady called Kate. She's worked as an RPN for 3 years, and before that, she was a PSW in the hospital. So, we're going to be interviewing her, and we're going to take the whole interview and include it in the video to show appreciation for the time she spent with me. So, any interview that is covered will be included as a whole. The point of this project is to show nursing as a lens through how you can help people and what the actual idea of nursing can be to a person. So I'm trying to bring as many perspectives as I can for people to grasp that idea. So that is the whole point of this project. So as I start, the whole interview process will be in this video. All right, let's get it.
I'm Kate. I'm an RPN. I've been at the hospital for 16 years. I've been an RPN for 3.
So what is your current area of practice as a nurse? Like, which area do you actually work in throughout the hospital?
So I'm up on 3B. It is kind of a mix of everything. It's medical, there's palliative, there is a lot of geriatric patients. Outside of that, like it's usually older people.
So, based on the experience you've had at the hospital and possibly before, what is your definition of what a nurse is? And what is one key learning moment from your career that has helped you shape that definition?
Oh, should have studied first. I don't think there's like a single definition of a nurse. I think there's so many different styles of nursing, and so I think it's important to kind of try a little bit of everything and see where you find the most kind of joy, but more like what's rewarding to you, what feels satisfying to you. For example, I absolutely would not enjoy working in mental health. It wouldn't be good for my own mental health, but I do really enjoy medical. I like the puzzles of it. I like kind of connecting dots and seeing how, well, if this and this and this happens, that must mean this is going to happen. Some of it ends up being really predictable once you see it happen a few times. I think if you don't like something, it shows, because you kind of end up doing sort of the bare minimum, right? Like you do the task, but if you're enjoying it, you're kind of going deeper in those things, and that benefits the patients more. I don't think I can pinpoint individual learning thing. I learn new things all the time, like nonstop, and I've worked with people that have been here for 25 years who, like, I've shown them stuff, they've shown me stuff, and you just kind of stumble upon stuff. I've asked other doctors questions, and they've sat me down and told me things like I was 5 years old, so that I fully understood. Like, sometimes you just need to hear it that way instead of in a clinical way. And I think just having good communication and good relationships with your coworkers opens up all of that. Did that kind of answer that? Kind of like,
yeah. So based on like how you're able to define nursing now as like these different styles and stuff, how different was it when you had just started your career? Like at the starting phases of your career, you just finished school and you just wanted to start the career, and you just began as a nurse. So how would you describe your definition and idea of that then compared to like now, based on your experience?
I think at the beginning, I was scared, very scared. I think collective, like as I talked to other classmates and new nurses as well, you think that when you start nursing that you have to actually know all the things as everybody else does, but you don't. And some people recognize that you're new and kind of give you that wiggle room, because you can't know what you don't know. If you haven't experienced those things, you wouldn't know how to do those things, and if you haven't practiced those things, you won't get good at those things. So everyone told me it was about a year or so that you'll be scared, and I would say that's true. And sometimes I'm still not scared, but nervous. I'm like, did I do this? Did I do that? What could I have done different, or how could I do this better? Before I was a nurse, I was a PSW on this floor, so I've always been up here, and so I had also the struggle of trying to pick my role. Like, I couldn't be a nurse and a PSW at the same time. and I had to prioritize those things. So I think it's a lot of learning how you work the best, how you prioritize your day, how you would do it would maybe be the same as mine. And that's okay, whatever gets you through a shift and gets all of your stuff done. And if it's not done, ask people to help you, because I've never met someone that told me no, do your own stuff. Everyone usually comes together and helps you get your things done, and if something comes up that's more urgent, other people kind of swoop in and help take over. And so I think expecting people to help me was weird at first. It was weird to be like, oh my god, come do all my stuff for me, but they're more than happy to. So that's kind of how the first year went. Now I'm much more comfortable, but when I come across things that I still haven't experienced, I kind of get nervous again, and my coworkers know that, so they come help me, show me what I need to do, show me where to find things.
So, would that be your main advice you'd give if you had met yourself again? If you got to go in a time machine and see yourself from the past of just coming into the nursing profession, would that be your advice, to not be scared to ask for help? What would be the main advice you would give to yourself?
I think you can't avoid the scare part. I think that's like having that nervousness is probably not a bad thing. I found people that think they already know everything definitely don't, and that's dangerous by itself. I think just making sure to have good conversations and establish relationships with people so that you're approachable and they're approachable, and not waiting to ask for help. I'm stuck on this, I'm gonna ask. Even if you know the answer, just ask somebody anyway to kind of get that confirmation. Like, I think it's this, and this, and they'll say, oh yeah, that's what I would do too. And then, it's just kind of double checking your assessments, your observations. Like, you're just confirming that with somebody else. A second set of eyes is always good. I think I would try to not be nervous to ask for help, basically. That would probably have helped. And I know everybody up here, but I still was like, no, I'm fine, I can do this all by myself. No, you're not meant to do it by yourself. Nursing is definitely a team and collaboration, and finding all your supports. And you'll figure out who your supports are. You'll have different relationships with some people, and I have several go-tos, and sometimes when they're not here, I text them instead of just because I know where to go.
Based on all of that, you must have had instances where the patient is not able to cooperate with you based on the professional advice you give. How do you try to balance that patient's autonomy with your professional obligation of trying to help them, even though the patient's autonomy is supposed to be top tier in this healthcare environment?
We kind of just did this. I had a patient that was really wanting to go home, and it would not be safe for her to go home. And she spent a lot of time insisting that she could. And she was almost gone, but then she had said to me some things about going home that would make her significantly less safe and quite a danger. So I did try to have conversations with her, sat at the bedside kind of explaining what the concerns were and why it would be better for her to stay. She definitely was really upset about that, so then we called her doctor and said, this probably is not a good idea, we should need to go talk about this. It's a tricky spot when they technically can make their own decisions, but it's really clear that the decisions would be not in their favor. She would really cause a lot of harm to herself had she left. She still has the option to sign out against medical advice, and chose not to. But had she done that, I'm not sure if she would even be okay, like, overnight. So I think you have to advocate. If you think something's wrong, you go tell your charge or your AR or your supervisor or your man. You just keep going up. If you feel like something's wrong, if you feel strongly about it, even if the patient thinks you're against them, it's for them, not against them. This patient was pretty upset with me for telling on her, but today she is fine. I don't think she knows it was me today, but I don't mind if she's mad at me for that, because I know she's safe.
Right. So what are some critical steps you might take when you're treating a patient you're supposed to, and then suddenly you notice an unexpected change in their condition? So you might have followed everything according to the textbook, and you notice this unexpected change, something that just happens out of a sudden. How life is unpredictable in a sense. You have all these stuff that happen unpredictably in the sense that the patient might suddenly go into a seizure or cardiac arrest while you try to help them. How do you sort of maintain your peace and be able to critically think, and what are some critical steps you might take even though you feel like you would have followed the textbook?
So I think in the moment, if something seems wrong, often there's kind of little signs that you would kind of catch. Their color changes, they seem confused, just physically they seem like weak, or like something is just off. Sometimes it's nothing that you could even see, but you're like, something's not right. You would kind of just grab your Criticon, you do some, grab a blood pressure, take some vitals, take a temperature, take a listen at their lungs, things like that visually. If it's more urgent, you would just go get your friends. You just go get some other friends, but you kind of start there, check those things, everything's good. You go grab a friend and say, hey, something's not right, come with me, let's go look at my patient. Still unsure, can't really pinpoint it, you call the doctor, ask them what they think. This is, they were doing this and this, now they're confused, they don't know where they are really suddenly. That's going to set off some investigations, but that's kind of just how you just kind of play it by ear. And I think every single scenario like that is different, so you can't textbook those things. Those are just in the moment. And like the critical thinking portion, you just kind of get better at that with time and experience, and when you start recognizing things that maybe aren't quite right. Does that make sense?
Yes, that makes sense. Since we're on the topic of conflict and complex situations, how do you handle fellow co-workers you might have difficulty with your work environment, whether it's a disagreement on like treatment plans and how to best accommodate the patient, or some conflict that started outside of work but now is affecting it?
I'm pretty non-confrontational, and I'm pretty good about pulling people aside and just having conversations that, like, I'm not attacking people, and it's not, sometimes it's maybe constructive criticism, but I really do try to have a private conversation and work out whatever. Perhaps it's a misunderstanding, maybe something got taken out of context. Sometimes people just don't work well together, like they have different energies and they don't work well together. Like you don't have to be friends with everybody, but you do have to be able to work with everybody, and it's dangerous if you can't, because you might not ask that person for help or tell them something's wrong with their patient. You know, you might miss something because you're being personal about it. So do you try to work those things out? I have had a conflict with a nurse in the past. For whatever reason, just didn't care for me, and I did try to have conversations with her. I did end up having to go to my supervisor about it, just because it was kind of just like weird, passive aggressive. I don't want to say bullying, but sort of. It was making it very uncomfortable. It did end up getting resolved for the most part.
Sorry.
That's okay. And that was a tricky one. I think if that particular coworker was around again, it would be uncomfortable still. But because I am more comfortable and confident in my role, I think I did navigate that better than I did originally. So I think for the most part, as long as you're communicating with people and being clear, and if it can't be resolved enough to cooperate, then you have to escalate it.
So then, how would you manage significant non-clinical problems, but like are characteristics that affect your area of work, such as being able to time manage with high priority tasks that can really affect like whether a patient lives or dies, and have pressure in a sense of like trying to make sure those tasks are done on time during that period of time? How do you sort of cope with that and sort of manage those clinical problems, non-clinical problems that sort of are characteristics of your career?
Like the things that are interrupting, like the non-clinical that is taking up consuming things that before you can get to the clinical, do you mean? I think you have to kind of incorporate some wiggle room into your day for those unexpected non-clinical things. Sometimes you can't because there's just not enough hours. Nursing is 24 hours, so if you potentially cannot do all of your tasks, you prioritize the ones you can do. So if you had to have IV antibiotics done, you would do that first before you did something, you know, like, yeah, I promised someone a shower, but I need to do this, I need to do this and this. I need to get these medications out. I have someone who is in a lot of pain. I need to make sure their pain medication is on time before I go do the things that are less clinical. But I couldn't get this wound care done because I was tied up with the person in the shower because they had an accident type thing, right? So when I pass over to the next shift, hey, I did all of this, but this happened. I could not get to this wound care. Can you do the wound care? Some people won't like that, but you can only do as much as you could do. If you have a charge nurse or a team lead, they should, like somebody, you should ask, that's where you should ask for help. But if you still can't get the help, narrow down your priorities to what has to your most important, your top ones, and whatever room you have left, just keep tackling the non-clinical. They kind of go hand in hand sometimes.
So now, looking to the future of medicine, how do you see this profession evolving, and what advice would you give to a student like me who's just beginning to create their reason to go into medicine?
Well, what is your reason?
Trying to make sure I can help people with what I know and what I learn. So I want to be able to use these skill sets that I learned in school and sort of learn to apply them so I can make lives better around me. I've seen my parents do it and I grew up watching them do it in a sense. And I'm trying to forge my own understanding of how I can help others using what I know and using what I'm capable of.
That's a great answer. Repeat your question again, though.
Looking to the future of medicine, how do you see this profession evolving? And what advice would you give to a student like me who's just beginning to create their reason to go into medicine?
So I think it's evolving in a sense that as an RPN, my scope has gotten a lot bigger. I would say on this unit, I do everything that the RNs do, and sometimes I help a lot of new RNs just because I have the experience before them. Like, they haven't done these things either, so sometimes I'm teaching them. So there's like, I know even 10 years ago, RPN had more of a PSW role with like medication administration, but now I've been responsible for everything, especially up here, and now it's more skills and ability. If you're comfortable doing it, you do it. They used to have RPN and RN assigned patients. Now it's you get the patients you get. And then I think now there's a lot of nurse practitioners that are kind of filling the gap because of the shortage of medical care for doctors and stuff. I think that's significant, and so I think the future is people that have the education and are capable are a lot more responsibilities, and I think that opening up will help a lot more people, and I think it'll skip steps of like people having to wait so long to see somebody at the top. Not the top, I don't mean it in a tiered way, but like to go see a specialist if there's
Since I'm in the suit, there's no way I could make it there on time. My mom said, look at the special door in our basement. So I decided to go check out this basement door and went through it. And next thing you know, I'm somewhere else.
versus treating it after it's already happening. I don't think there's enough preventative care, and I'm hoping it goes that direction instead, because I think that's one of the bigger problems of partly COVID, I think, had an impact on that too, where nothing was happening preventatively. We waited until everything was gone too far, and like we're treating things that we could have prevented easier with little things, even as much as like.
The interview starts now.
Does that make sense?
Yes.
I know, sometimes I start rambling, I'm sorry.
You're good.
I'm a rambling person.
So what would be the advice that you would give to the students?
Advice? I think being open-minded and keeping in mind like compassion, of course, being aware of how you look at people. I don't think you'll have a problem with that, but like just deciding somebody's background because of how they look or how they dress, or maybe they haven't had a shower in a really long time, and kind of deciding that kind of stereotyping of sorts. I think that's really dangerous. I think it happens a lot. I went to a walk-in clinic for refill medication once, but it was an ADHD medication, and they kind of were implying that I was looking for medication, and I was like, no, I actually need it, but I said also, you're not supposed to do that, and don't do that, and I tell everybody not to do that, even when I have nursing students on the floor with me. I'm like, don't decide things. It's those things, you don't know the history of that, because it'll affect what you're willing to do for that patient. If you are in your head about those things, you might not give them all of the things you could have access to. Do you know what I mean? Like it's I feel like if you keep those things, those aren't an option. Focus on the patient. If you don't understand their condition or the treatments, ask somebody what those things mean or what that impacts. Because the more you know about those things, it'll help you connect dots each time that happens again. And it might help you catch things that got missed. Which is great because nobody's perfect and things do get missed. I think just being aware and again asking questions, keep trying to learn stuff. Not obsessively, of course. Sometimes I wake up in the night and go, what about this and that? And yeah, but that's just me. Well, it's probably not just me, but I do that. Sometimes I take it home with me. Don't take it home with you. You're gonna take it home with you. You take it home with you too. Yeah. Oh yeah, that's kind of it. I think you just go with the flow. I think make sure you don't isolate yourself. Ask lots of questions. If you have questions, you can ask her and you can ask me. I don't care. If I don't know, I'll find out for you. Lots of people will. So just don't ask me about trachs because I don't like those. But that's another example, right? I do not like them. So I'll trade that with another nurse. I hate trachs. How about I take your PV patient or something like that? Sometimes I just do it anyway, but I don't love it. And that's all. I'm sure there's more. Yeah.
Thanks for your time.
Yeah,
Thanks for
of course.
all the advice that was presented towards me during the interview, and all the nicks and tricks that you've sort of faced and dealt with, and how you've handled different situations that I can sort of learn from. So I really appreciate all the time that you spent here today and for being in the interview. So
Yeah, no problem.
That's all we have the time. That's all the time we have for today. Thank you.
I've got time now.
Whoa. What? I'm no longer in my scrubs anymore. And I'm back in North Bay. With the jacket and hoodie that I left. Obviously I can't wear my hoodie, so I'm gonna switch to a white shirt. But this is crazy. What a door. And now I'm in North Bay. Well, time for another interview, I guess. So I'm here with Logan Burns, a professor at Nipissing University. She's teaching health assessment, and she's also a nurse at the hospital in North Bay. And we're going to be asking her a few questions to fully grasp the lens of nursing as a profession. Hi. So what's your current area of practice as a nurse?
So I currently work in the emergency department, as well as northern, remote and rural contracts, and then in academia teaching at Nipissing.
So based on that current area of practice, what would you say your definition of what a nurse is?
So I'd say a nurse is someone who can care for people on multiple levels, that they have a strong understanding of like the medical science behind what's going on, their like the patient's condition, things that might happen, where care is progressing, but then also meet the patient emotionally and mentally where they're at and provide support for kind of that side of their being as well as their physical health.
And what is one key learning moment from your career that helped shape that idea?
I'd say there's been a few moments. Two moments personally to me when I had like my dad had a heart attack, and I had to see him as a patient, and see kind of that side of the world, and become the family member who, even though I was like a trauma resus nurse, I went into his cardiac ICU and was like, I don't understand anything on the monitor, even though I clearly did, but I wasn't a nurse then, mentally. So seeing that side really brought like the human side to it, and then having patients who, even with like very serious things happening, could find kind of the like joy or humanity in at least like our interactions, even if there was like awful things happening. So just like remembering that like these are people, right? It's not just like the diabetic guy in bed 4, right? It's like, this is John, and John has a whole life that he's happy to tell you about. So yeah, I think just like over time, as I got more confident in my care overall, I didn't have to like dwell so hard on the physical part to be able to know that, so then I could focus more on the other side of it.
So I'm gonna compare this definition with, I want to know how different would you say your idea right now is compared to when you just graduated from nursing school to like the experience you have now in the actual field, and how fast did reality sort of kick in afterwards, that you're not learning the same way as you were in school, it's no longer just a textbook, it's actual in person.
I'd say in school we like very much had it hammered home that like patient first language, the holistic care and all of that. But when you first graduate, you're like so scared of someone dying. I went right into the emergency department as a new grad, which I don't really recommend, but like you're so worried that everyone's dying that you're so focused on that physical health and not missing anything, that it probably took longer than had I been in a less acute area or in like a more focused area. Right? Probably, I'd say I definitely noticed it right away, but I didn't have the capacity to act on it probably until like a year or 2 in.
So how would you say that definition of nursing evolved in a sense from initially?
I don't think my definition of nursing really evolved at all. I think my capacity to do it changed. Like I always knew in my head, right, like it's important to treat them as a person. But as a new nurse, it would be like, okay, I got them water, I got them a blanket, I was like, there, you'll be okay. And then I had to like do the physical things, right? I had to like give the meds, do the dressings, assess their vitals, monitor them, report if anything's changing. Whereas now that I can do those things with less cognitive load and less focus on the physical, like I can sit down at a patient's bedside and I'll just like chat with them about their life, about what's going on, about what they're worried about, and in that conversation is like half my assessment now, right? Instead of having to be like, okay, I'm assessing neuro now, I'm assessing this, I can like let it flow more organically.
So based on all of that, what advice would you have given yourself, like again from the experience you've had now, back to when you just came out of nursing school, like you just came out based on experience now, what would you tell yourself?
I think I would probably tell myself to, one, give myself grace in the learning, give myself the time to actually learn, probably not go right into emergency nursing, like take time on a unit where it's either like a more defined population or people aren't quite as sick, where I can take the time to like learn those things but implement the human side earlier, and then not put as much pressure on myself to get everything perfectly right off the get-go, and that there are other people you can rely on for kind of the day to make sure that you're getting the medical side right, to give a little bit more of the interpersonal side.
Based on the response, situations are not always perfect, and you have to like learn to adapt and change. So you probably had instances where a patient does not want to cooperate because he or she does not agree with your professional judgment. How do you respect the patient's autonomy while aligning your actions with your
professional obligation?
I very strongly agree with like the patient's autonomy. I think patients should be able to make their own choices, and they should be able to get the care they want. I do definitely make it a point to make sure they understand what it actually is. I found a lot of patients, like when we tell them they need, say, a certain treatment, they can either be overwhelmed by their diagnosis or misunderstanding what the treatment is. So very like clearly explaining that, making sure they get it, that they can like explain it back to me in their own words and that it's accurate. And then at the end of the day, if they don't want it, even if it is what's best for them, as long as they understand what is coming out of that, you might get sicker, you might die. I use the words death and dying a lot. We don't really like beat around the bush in that sense and be like, bad things can happen. If they understand that, like, it's fine. They can not have whatever treatment we recommend. They'll still, from me, get the same care that they would, just like minus that actual treatment. Like they're still gonna be treated like a patient, they're still treated with respect, dignity. We'll do everything else that they agree with. But at the end of the day, it's up to them, so. Document well that they didn't like it, they didn't want it.
Makes sense. So then, what are some critical steps you might take when you're treating a patient? Like you might follow all the rules and guidelines that you've learned throughout your experience and study, and then you notice that there's this unexpected change within the patient's condition, and how do you sort of apply your critical thinking skills based on those applications? Because now it's not just textbook, it's just your own you versus whatever the patient's going through, and you might follow exactly what the textbook says, but next thing you know, it's an unexpected condition the patient might have. So what are some critical steps you might take towards helping?
So critical steps are always like your ABCs, right? So like make sure airway, breathing, circulation supported, and then get help. Every single assessment I'm doing, I'm critically thinking through it all the time. Every interaction with my patient is a critical thinking moment where I'm thinking about, is this different than the last assessment? Has anything changed? Why are their vitals what they are? Why are they expressing pain now? Like, what is the reason that everything's going on, and is it related to their current admission diagnosis? Is it related to something like underlying that a previous condition that we do know about, or is it something like completely out of the blue? In the Emerge, we don't know a lot of people's medical histories, so we're doing a lot of that all the time. If something's going very badly, so we're getting help right away. I won't leave the patient, I will get the call to get help. So either yell out for help, or we have a code blue button or a staff assist button, and hopefully between the team, we can resolve what's happening.
So how do you maintain your peace and like be able to think clearly when things sort of happen out of the blue? It's not what you expect.
I have a very strong foundation in anatomy, physiology, complex health. So I've made sure I have like the educational background to understand what's going on. It's been 11 years now, so I've seen a lot of awful situations. So just knowing what to do, at least knowing the first like 5 steps I need to take before someone gets there. If I can do those 5 steps, there will be someone else there to help with the rest of it. So knowing at the end of the day, like I'm going to do everything I can, everything I know how to do. It's probably what brings me the most peace. I can't fix everybody. I can't fix every situation. And sometimes people just do poorly. Right? We can do everything textbook right. We can pull out the newest research. We can try something like totally new and like kind of made up, but based on all of our like understanding of physiology and pathology and everything like that. And it might just not work. And that happens. So you quickly get used to that in an emergency department.
Since we're on the topic of complex situations, and in the area of conflict, how do you handle fellow coworkers who might have difficulty within your work environment to cooperate with you? Whether it's just a disagreement based on treatment plans and how to best accommodate the patient, or if it's some conflict that started outside of work but now feels like it's affecting you.
So to me, it depends on if it's a disagreement that affects the patient or not. If we're disagreeing on some, in the end, inconsequential thing, it doesn't actually matter how it goes. They can do what they want. If it's their patient, it's their license. If it's not going to harm the patient, have at it. If it's something that is going to harm the patient, it's either not the right way to do something, they're falling behind on their timelines, things like that. I'll offer to help, I'll offer my opinions. If it's my patient, I will take over their care and make sure that it is done to the right standard. On every unit, there's a charge nurse that you can always get involved and get their opinion if you're not agreeing and you can't come to a consensus on what to do. At the end of the day, the patient is like the central priority, and they need to be taken care of well and properly. And everything outside of that doesn't really matter. Once the situation's like resolved and the patient's taken care of, I'll usually try and have a conversation with the nurse in like a private moment. So you're just like popping into the med room, into the break room, something like that. Then like try and resolve it that way. For situations outside of work affecting work, there's not a lot of like interprofessional or not interprofessional but interpersonal conflict that would carry into work for me. If it's my own stuff, like I have pretty good tactics to like leave my shit at home. When I get to work, I'm there to work. I'm there to be a nurse. I'm there for the patients. My shit doesn't super matter. It's probably not the best like coping strategy. But at the end of the day, like I can deal with my shit later. If it is so bad or something that's affecting me so much, I will request either be in like a less acute area. So the department I used to work in had like a mini, essentially inpatient unit where they're like waiting for their floor on the bed. But like request to be there versus our like resuscitation zone.
So then, since we covered like how you manage conflict in complex situations in the healthcare environment, we'll talk more about like non-clinical characteristics that you sort of need, but it can be like problematic if you don't know how to handle it. So how would you manage significant non-clinical problems like time management, high priority tasks that affect your clinical profession?
So for that, we just need to be really good at prioritizing. Again, it's falling back to like anatomy, physiology, pathophysiology, what is going to have the most significant impact on the patient. In the emergency department, we have a lot of demands for tasks that are all high priority. So figuring out like ABCs, which one is going to kill the patient? That one needs to be done. Right. If a patient needs a blanket and a drink of water, I can easily delegate that to our support staff, where I can't delegate giving meds. If there's multiple like life-saving meds that need to be given, I will ask for help from another nurse. I'll prioritize which ones are the most important in that exact moment. Try and work through it as best you can, delegate, work as a team. Teamwork's like crazy huge in the emerge, so we can't actually do it all.
So now, looking towards the future of medicine, how do you see this profession evolving, and what advice would you give to a student like me who's just creating their reason to go into medicine?
In terms of the profession evolving, I'm hoping there continues to be increasing autonomy. That nurses can like make their medical decisions, use medical directives, like teamwork and communication continues to improve interprofessionally. And we don't yes, doctor, have my seat anymore. But there is still some physician-nurse hierarchy going on that I'd like to see do away with, because it supports a lot more communication about your patients, what's going on with the patient, and gets them the care they need faster. For a new nurse developing a reason why, they really need to kind of figure that out for themselves, what matters to them about healthcare. Choose an area that you're passionate about but isn't super overwhelming off the get-go. A lot of new grads want to be emerged, they want to be critical care, NICU, all of the specialties. Floor nursing is very much an important part of nursing and a highly skilled area of nursing. To be able to manage high patient volumes in a timely manner, I think is where all nurses should probably start. Figure out what is important to you, what adds value to you. Don't apologize for everything. Not everything's your fault. I stopped apologizing for things to patients probably 3 years into nursing. They'd be late from x-ray. Oh, I'm sorry you were late. Oh, their meal was cold. I'm sorry your meal was cold. None of that is my fault. I can't control it, so don't take on the responsibility of owning things that aren't yours to own. You can still empathize with their frustration about being left in the hallway at x-ray or getting a shitty meal, but it's not your fault at the end of the day. And don't be afraid to change areas of practice. Sure, start in medicine and then try out surgery and then try out community and then try out emerge. Move around. If you're not happy in one area, you don't have to stay. You don't have to be an emerge nurse for the rest of your life. You can dabble wherever you want. That's probably my biggest advice for new people.
And that's all the time we have for today. Thank you for the interview and taking the time to spend with these questions and spend some time. And I really appreciate you being able to sit here with me.
No problem.
So we gathered a bunch of information from two different people who serve the profession of nursing. From these two different perspectives, we're going to critically analyze and try to understand what nursing can mean and interpret it through these angles that they've provided for us to look from. Because now nursing is not just at the superficial level, it's at the deeper core level, because we covered topics that arise within the profession, such as handling peers, working with patients, and most importantly, their selves, their own selves. So now with all this information that we've gathered, let's go to our thinking chair, which is not this one, by the way, that comfortable one over there, and really try to understand the words that they used and learn from what we can understand based on what they said. Thinking chair. Hello there. All right. That's not where you're supposed to be. Let's sit you right up next to the thinking chair. The thinking chair is where we make all of our critical analysis. Pretty important stuff, if you say so. If I say so myself. So we're here. And this is where we're going to talk about everything we have listened to. Critical analysis of the interview and a connection with what I was trying to get out of the interview. And the best way to do that is in my scrubs, because I gotta get used to it, and I already love them, and it's probably because I just got them, but I already love them. Anyways, back to the matters at hand. We're going to be talking about the sources and how it connects with the interview and what we've seen so far. So we've gathered a bunch of information from Kate and Logan. On the surface, their jobs look different. Kate is up on 3B dealing with medical puzzles, and Logan is in the emergency department. But when we really try to understand the words they use through the lens of nursing literature, we see the same patterns. First, let's talk about the fear. Kate admitted that at the beginning she was scared, very scared, because you feel like you have to know all the things, according to her, that quote unquote. Logan felt the exact same way. She said as a new grad, she was so worried that everyone's dying in nursing. In nursing theory, Judy Duchinsa calls the transition shock that intense pressure new nurses feel when they leave the textbook world for reality. Hearing them both admit that proves that feeling nervous isn't a weakness, it's part of the process. Then there's the human side. Logan told us that chatting with a patient that their life is now half her assessment. Kate echoed this, saying, if you enjoyed the work, you go deeper than just the bare minimum tasks. This connects perfectly well to the Potter Perry, which defines nursing as both an art and a science. The science is the crash cut and the ABCs. The art is what researchers like Ping Zhu called relational practice, meeting the patient's emotional and mentally where they are. Meeting the patient emotionally and mentally where they are. Finally, we looked at the tricky balance of autonomy. Kate shared a story about a patient who really wanted to go home even though it wasn't safe. Logan agreed that even if a choice leads to death or dying, the patient has to understand that it's their choice because we are under the CNO's code of conduct, which reminds us that we must advocate and explain, but ultimately respect the patient's right to choose. Kate sort of gave us a different perspective of things where we can try to convince the patient by being an advocate. Yes, you can lay out the terms of what is necessary. You can tell the patient that the decision they're about to make could possibly cost them their lives, as Logan has mentioned multiple times. And Kate took that one step further and was able to say, we are able to contact our supervisors, and if we are having any trouble with with being able to understand that the patient has full autonomy of their decision, sometimes it is best to be able to contact the patient in a way to communicate with them the value of their decision to make sure they pick the right one. Because at the end of the day, it is the patient's decision, and all you can do is convince them. But it's best to really try to convince them because we are playing with life. And it's pretty critical. And that was very valuable. And I learned that sometimes we can do something. Even if we feel like we can't, we can do something. So, what is a nurse? My lens has shifted a lot. I used to think it was just about fixing problems. Now I realize it's about connecting dots, building a bridge between science and the person. As I said earlier, I want to use these skill sets to make people around me better, have a beneficial life, as I mentioned during my interview towards Kate. And now I know it starts with not being afraid, because that was pretty critical by both of them. Being nervous is okay. Being a bit scared is okay. But don't let that fear drive you. End of the day, you are learning. And what you learn can help people. So ask questions, grow, and most importantly, enjoy the process. Have confidence in what you do and love what you do. And nursing shows that. And there is no other profession, no other area that can critically analyze the way the healthcare providers do. And this project has made me fall in love with the medical field even further. So that is a direction I really do want to end with as a career for the rest of my life. So, like I said, starts with not being afraid to ask for help and remembering the patient is a person, not just a bed number. My own reflection of what is a nurse. A nurse is someone who's confident, someone who's willing to learn, someone who wants to grow, and someone who has a heart to help others. And this doesn't just apply to nurses. It applies to PSW workers. It applies to the paramedics. It applies to the doctors. Nursing is a scope of what we looked at. But nursing is a big puzzle of the healthcare field. And it really opened my eyes towards how wonderful the healthcare environment is and how much nurses impact them. That is my critical analysis, and I've shown you what a nurse is through the perspective of others and my own perspective. And last but not least, I would like to mention why a nurse chooses to be a nurse. They choose to be a nurse because at the end of the day, they want to use the skill set they have and what they can learn to help others. If not, it's for the money. Money's money. You get money, you get paid. Get paid, you live a happy life. That's it from me. So either you want to help people or you want money. There you go. Nursing. And we are done. That's a wrap. The end. That's all, folks!